2 years ago, I was in a drunk driving high-speed motor vehicle collision. I made the regretful decision of getting in a vehicle with my best friend while we were both intoxicated. Thankfully, after all the help of the employees from the emergency department, I was able to have a complete neurologic recovery.
A 17-year-old girl was brought into Norfolk General Hospital at midnight after being involved in a high-speed motor vehicle collision. Officials say accidents have been a rising concern in the community. Today I'm here with Officer Hoyle, who was present at the site of the accident. During your career with the OPP, what factors have you seen increase of the risk of a motor vehicle collision? Driving is a privilege and can be very useful, but when safety precautions and rules are ignored, it can be very dangerous. It is shown that drivers under the age of 25 are at the highest risk of motor vehicle crashes. Some of the largest factors that include this are alcohol usage, distracted driving, driving with other teenage passengers, risky driving behaviors, incorrect or no seatbelt usage, weekend or nighttime driving, and driving in bad weather conditions. Taking a medical perspective in this incident, paramedics at the scene will give you insight on the teen state's moments after the collision. As a medical professional, what was the most alarming medical concern of the girl brought into your care?
What immediately stood out to us was that her vital signs were dangerously low.
What are vital signs and what are normal vital signs look like in an adult?
There are 4 vital signs: body temperature, pulse rate, respiration rate, and blood pressure. Adults usually range from 97.8 to 99.1 degrees Fahrenheit in body temperature, 90/60 to 120/80 in blood pressure, and have a pulse between 60 to 100 beats per minute and breaths between 12 to 18 per minute.
Another alarming concern was that the patient's oxygen saturation were low upon arrival at 82%. The patient had significant amount of blood in her mouth as well as missing teeth. It is possible that those teeth went into her body rather than out. Also, alcohol can disrupt the absorption of oxygen by hemoglobin in the bloodstream.
Are there any other factors you would consider in a trauma?
A factor that could be considered in a trauma like this is internal bleeding.
Thank you, and we appreciate your time.
Hey, Dr. Malo. I have to do a primary survey of ATLS on a patient. Could you please remind me of the steps?
Yeah, so step 1 begins by checking her airways, circulation, and breathing. Then we need to ensure that enough oxygen is getting to the tissue level. Next, we need to determine if the patient is maintaining a high enough blood pressure. For the 4th step, we perform a brief neurological exam. Following this exam, the state of her head must be evaluated. An assessment of the spinal region must be completed. A final body exam for other injuries is the final step of an ATLS.
Okay, thanks. I'll go get that started. Hey, Dr. Jackson. I just did a primary survey of ATLS on our patient. Could you just remind me how alcohol metabolizes in the body?
Well, that's a great question. There are several processes and pathways by which alcohol is metabolized. The alcohol molecule is broken up by alcohol dehydrogenase and aldehyde dehydrogenase, making it possible to eliminate it from the body.
Thanks. Could you also just clarify what is the metabolite responsible for the majority of side effects for alcohol? I remember it to be acetaldehyde, is that correct?
Yes, that's correct. Acetaldehyde is responsible for most side effects from alcohol, such as several types of cancer, dilated blood vessels, stomach lining irritation, and high blood pressure.
Good morning, Ms. Dedner.
We are happy to inform you your daughter is doing well and making good progress.
I'd also like to add that she's in great hands and will definitely have a speedy recovery.
Yes. We've done a fast exam and as well used our GCS to determine the levels of consciousness when she died.
Okay, great. We really appreciate it. Can I ask what is a FAST exam and how your GCS works?
A FAST exam is a focused assessment with a sonography for trauma. The FAST exam evaluates the pericardium and 3 potential spaces within the peritoneal cavity for pathologic fluid.
And as far as the GCS, your daughter's eyes were responsive to pain. She had reactive pupils, withdrawal, and slight vocal grunting. These characteristics could give her an overall GCS value of 7.
Thank you. We really appreciate everything.
Anytime. We'll be sure to keep you updated. I was beyond lucky to have a wonderful staff that took care of me during my time at the ER. Without them, I'm sure I would not have been able to have the full recovery that I did. With that being said, I would like to thank the paramedics, physicians, doctors, the wonderful student nurses, and my mom who was by my side through it all. I don't think that everyone realizes, including myself, the importance of taking all precautions necessary when driving. Driving under the influence is a serious matter that can result in injuries far worse than mine. And although I'm not proud of the decisions my friend and I made that night, if sharing my story will help educate others on the importance of driving safely and avoiding driving under the influence, then it's worth it.